going to be having an unfiltered, no BS discussion to show you the true diversity that exists in beauty around the world. Take full control of your quest for your own beauty. All right, everyone, welcome to Uncensored Beauty, where in this podcast, I'm going to be talking to you about all things beauty, as you probably saw in the trailer. One thing I quickly wanted to address with you guys is exactly what it is that made me want to create this series. And so much of it has to do with the fact that I myself have pretty much always been obsessed with the notion of beauty, which is what made me become a plastic surgeon. And ultimately, being a plastic surgeon, I don't see it as just being a medical doctor or a surgeon, but rather I see it as the pinnacle of being a beauty expert in a world that is so infatuated with beauty. And that's one thing I've always said, is that ultimately beauty is part of the human condition. The quest for beauty is a part of the human condition. So that's why I think it's so important that you, as the consumer, understand exactly what it is that you should be doing for your own beauty goals, and try and cut through the noise of all the BS that exists out there about what beauty is and how you can achieve those things. So for today's episode, we're going to be starting out with our first episode, and the title is The Fine Line Between Enhancement and Addiction. Now, obviously, you've probably seen a lot of this around the media of people who overdo their cosmetic surgery. And this has created some level of a false narrative about what plastic surgery actually is and what beauty actually is, especially in the world of pop culture. Because the challenge with plastic surgery, especially as a plastic surgeon, is that oftentimes I'll hear from people, well, I don't want plastic surgery because all plastic surgery looks overdone. That's not necessarily true, and for the most part, it's actually quite untrue. The only reason you may think that is because the ones that are the most visible are going to be the ones that you see, and the ones that are the most visible are often the worst jobs that you see. The people who have the undetectable plastic surgery aren't standing on the street corner screaming to you, hey, I've had a nose job. So you're not going to necessarily know if somebody has had plastic surgery, which is why oftentimes you're going to see the most extreme versions. And that brings me to the point of what is that fine line? How do you really go and try and achieve a more beautiful standard for yourself, but not necessarily fall into the trap of constant enhancement to the point where you end up with things such as pillow face? So along those lines, I wanted to highlight one specific person who I recently saw stories about and has been in the news for years now for her overdoing of cosmetic surgery. Meg Ryan was in the 90s and early 2000s your basic girl next door. She was known for her soft features, her curly, gorgeous blonde hair, her very relatable look. But it was pretty quickly in the late 2000s and early 2010s that she started to transform the way she looked. And frankly, in the media, people were very harsh about her aesthetic because she ended up looking very overfilled and overdone. And that was from a combination of surgeries, fillers, Botox, and everything else in between. Now, my point is not really to shame Meg Ryan whatsoever. I fully understand that everyone has their own journey and everyone has the right to do whatever they want with their own bodies. But at the end of the day, I think it's fair to say that Meg Ryan's goal was ultimately not to end up looking puffy, but she just wanted to look refreshed. And this is something that not just Meg Ryan, but many women, if not most women, especially in the pop culture world, struggle with, because there is this pressure that exists, especially among young women, to maintain that youthful, beautiful look throughout their whole lives, when it's not ever going to be possible, even with plastic surgery, to look like you're 22 years old forever, right? You're going to age, you're going to change. So the big question is, when does enhancement actually become an obsession? We've seen it, like I said, in the before and after photos of people who've done one too many procedures. To me, I think the real line, it's not as sharp as one would think it is. It's not like, it's not like you get one extra syringe of filler and all of a sudden, boom, you are suddenly overfilled. You suddenly have pillow face. But what people often don't understand is that this is a very gradual process when people get to that overdone stage. And oftentimes the culprit in this is both the media as well as the practitioner themselves. As a plastic surgeon, I oftentimes will turn people away from my office. Sometimes up to 50 and 60% of the people who walk into my office for a consultation don't end up getting the procedure that they wanted. And frankly, sometimes don't end up even getting the procedure at all. And that's because people will come in with a certain idea of what they want, but a complete lack of understanding of what it is that's going to get them there. So in the case of, let's say, Meg Ryan, I probably would have, or definitely would have guided her away from a lot of the procedures that she had done, because I know that that's not what she actually wanted. You know, when someone comes to my office, they talk to me about their whole lives. They share everything with me. And that's why I've always thought of plastic surgeons not just as surgeons, but in some ways as surgical psychologists. My goal is to sit there and talk to somebody and really get a sense of not only what do they want, but why do they want it? And I've always said, if somebody comes to my office and tells me that they want a cosmetic procedure done for anything other than themselves, even if they say, my husband wants me to look like this, my friends want me to look like this, I have to be on a TV show and I need to look a certain way, that's not a good enough reason to have a cosmetic procedure done, because these changes are going to be somewhat permanent and you ultimately are going to have to be the ones to live with it. So that's my job as the plastic surgeon, to sit there and parse through all of the motives, right? It's not just about the physical person in front of me, but rather what's going on behind the veil in the mind. What are they thinking? What are you going through? And how is this cosmetic surgery going to ultimately enhance you? I think the same thing goes not just for plastic surgery, but any cosmetic industry product. Even you're talking about makeup. Some people love wearing red lipstick. It's a bold choice, but some people love that boldness. I also have friends and patients who they hate wearing red lipstick because they don't like the attention it gives. They don't like the way that it necessarily alters their face. It doesn't make them feel confident. So why would they do it? And that's my same principle with any surgical procedure or injectable, etc. Going along those lines, talking about that fine line that exists between having a procedure versus getting to this addicted stage, I also have to parse out the concept of body dysmorphia and be able to identify body dysmorphia in people. Now, body dysmorphia is also another thing, shockingly, that's misunderstood by a lot of people. People assume that if you have plastic surgery, you definitely have body dysmorphia. Is that true? I guess to some extent it can be, because the important distinction to make is that there's a difference between what body dysmorphia is versus body dysmorphia disorder. So it's the same principle as like in psychology. I know many people have anxiety, right? But there's a difference between having anxiety versus having an anxiety disorder. And the biggest difference between that line of a disorder is whether or not it affects you so much on a daily basis that it actually alters how you live your life. So having body dysmorphia and thinking, oh, okay, I don't love the extra fat around my waist, so I'm going to go to the gym and I'm going to go work out and I'm going to try and get rid of that fat in order to look better and feel better about myself. Is that body dysmorphia? Yeah, it is, because you're not happy with the body that you're necessarily in. But is it a disorder? No. Where that becomes a disorder is when you start fixating so heavily on it that you refuse to wear anything that's not baggy because you think everyone's looking at your tummy, where you refuse to go to parties because you're thinking everyone's judging you for being really fat, and all these things that you're preoccupied with. You're assuming what other people think of you and then allowing that to alter the way you live your life. So when it comes to my practice, I look at somebody, I identify the body dysmorphia. Frankly, I have it myself. I've had my nose done, and that in and of itself was a product of body dysmorphia. And you could even say I had slightly a disorder, because I distinctly remember when I was a teenager, before I had my nose done at the age of 19, whenever I would be driving in the car and I would get to a stoplight, I hated my side profile. And if there was somebody who I found attractive in the car next to me at the stoplight, I would actually find myself turning kind of to the side like this, obliquely, because I didn't want them seeing my side profile. So was that slightly altering my behavior because of a fixation on a physical feature? Yeah. But is that a good enough reason not to have a nose job and force me to live with the nose that I live with? No. And that's exactly what my surgeon did at the time, was parse out how much of that actually was a reasonable concern about my aesthetic versus an unhealthy concern about my aesthetic, and whether or not it could be addressed through surgery, which clearly it was, since I'm sitting here proudly on camera in front of all of you. Clearly I don't have any shame about my nose anymore. So I think ultimately when you look at someone like a Meg Ryan, like the people who are in pop culture, even another example would be like Courtney Cox, who has been very open about her journey with her own fillers and how she overdid it. And one thing she always highlights in her interviews is that she had no idea that she looked that crazy. And that's literally what she says. She ultimately says that she was going to practitioners, getting fillers, getting Botox, and constantly filling, thinking that by looking plumper, she was looking younger. That's not always the case. The one thing I remind people, I often have some people come in and they say, oh, I don't like how deep my smile lines are. And they want their smile lines completely gone, which at the end of the day, I then go show them a picture of a baby. Even when a baby smiles, they still have laugh lines. That's a part of natural expression. So that's something where I think you can really tie in that body dysmorphia aspect into, because if you're obsessing about something that you think is making you look older, when in fact it's a feature that exists even in the youngest of young people, then there's a disorder there. And that's my job to tell you that no, based off of my expertise, that's not something that needs to be filled. And if it does, it should be done very conservatively, because we don't want to blunt the natural features of you that already exist. And that kind of also then leads to this question of this false narrative that also exists, where people constantly blame changes on cosmetic surgery. I think there is a genuine misunderstanding among the general public about what each of these different beauty products or beauty procedures actually are. One of the things I often hear people confuse are Botox and fillers. So just so you know, Botox is what's called a neurotoxin. So you inject it in order to paralyze muscles. That's not going to have any kind of filling effect on you. So if somebody comes in and says, oh, I got a bunch of Botox in my cheeks to fill them out and lift them, I quickly have to correct them, because I know that's not Botox. That's filler. That's a totally separate thing. Filler is usually a synthetic substance that's manufactured similar to your own collagen or other different forms, and that's injected just to give volume and plump you up. Botox, though, like I said, is just paralyzing. So this is a good example of where I think we have to really parse out and understand what is the difference, because I'll also see people who they get a facelift, and a lot of people will then blame it on Botox. Not the same thing. A facelift is a surgical operation. I'm literally cutting open your face and lifting everything, pulling everything back. It's very invasive. Botox is you sitting down in a chair for 5 minutes, having a few needle injections, and then a nice little brightened look to yourself. It's not going to have the same level of drastic change as any specific surgical procedure. And I think ultimately, I may be a little biased here, but based off of my understanding and my studies of the world of beauty, the reality is plastic surgeons are not the ones to blame here for these unrealistic beauty standards. The plastic surgeons are ultimately treating a symptom of society. It's not the plastic surgeon that came and told Meg Ryan, oh my God, your face looks so deflated. What happened to that 90s it girl? It's society that did that. So Meg Ryan came to the plastic surgeon, came to the injector saying that, oh my God, on People magazine, on whatever tabloid it is, they keep highlighting how old I look. They keep taking pictures of me where my face looks deflated. So as the practitioner, I would be the one to suggest ways in which she can combat that perception. But a lot of society has decided that it is us who are the villains in this scenario, and that I'm walking around looking at people on the street and saying, hey, your face looks terrible, come and see me. I would never do that to somebody. And if I did, I'm pretty sure you'd see a news story about me in a pretty negative light at some point. So the reality is we have to also focus on what society is pushing. And if we want to change the way in which people treat their beauty journey, it's a lot more important to focus in on the societal aspect of it rather than the practitioner. Okay. The other thing I think is a real culprit in creating these kind of misguided beauty standards is going to be social media, and it's going to be the filters that exist. A lot of people don't know this, but especially on like Instagram, TikTok, Snapchat, there are provisions within the actual contract of these companies that state when you take a photo of yourself using their app on a front-facing camera, it will automatically enhance your photo by 2 to 3%. Now that's nothing that you're going to necessarily notice, but it's going to slightly smooth up your skin, slightly brighten your features, make your eyes a little bit bigger. Things that will be so subtle to you, but ultimately are going to feed into that sense of insecurity about yourself, because when you look in the camera and are filming yourself, you're going to see one thing. Then afterwards, you go look in the mirror and all of a sudden you notice, something looks a little dull. Now, what I want you to do is resist the urge to immediately run to a nurse injector or a plastic surgeon and say, fix it. What I want you to understand is that you are purposely, in many ways, you're purposely being misled in order to then seek out beauty treatments, seek out alterations, and frankly, in some cases, just end up photoshopping your photos in order to feel better about yourself. This ultimately also comes down to who should you be seeing, right? At the end of the day, it's obvious that there are plastic surgeons and there are practitioners out there who are doing too much. They are overdoing it with the procedures they're doing. They're overdoing it with the fillers that they're offering people. And that's because at the end of the day, there's profit to be made and people will often take advantage of that. But how can you know whether or not you're going to the right practitioner? Well, the one biggest piece of advice I have when it comes to looking for a plastic surgeon specifically is make sure that your plastic surgeon is somebody who is being trained under the board of plastic surgery, whether they're board eligible or board certified. The big thing people don't know either is that a lot of people who tout board certification are not actually talking about the board of plastic surgery. They're talking about cosmetic surgery boards that are not recognized by the AMA, the American Medical Association, and are kind of misleading you because a lot of these board-certified cosmetic surgeons are often family medicine doctors, ER doctors, dermatologists, people who don't actually have the surgical training to be doing these procedures and are touting themselves as board-certified after literally taking sometimes a 3 to 4 day weekend course on the principles of cosmetic surgery. Now, as someone who is a board-eligible cosmetic surgeon, I will tell you 3 to 4 days is nowhere near enough to even scratch the surface of how to do plastic surgery in the proper and safe way. And in the odd chance that that person gets away with doing your facelift or your tummy tuck and you don't have a complication, don't think that they are some miracle worker. Ultimately, you just played Russian roulette and you happen not to get shot by the bullet. That's all it is. At the end of the day, you need to make sure that your cosmetic surgeon is somebody who is properly trained. I think that makes a lot of sense to me. So the other thing I would also say when you go see a practitioner is make sure that you feel a sense of trust and really demand transparency. You know, one of the things I actually find interesting is you would think, as far as on a business standpoint, if you tell somebody, no, I'm not going to do that procedure, or no, I don't think what you want is the right thing, it would turn them away and make them angry. But one thing I've actually noticed is that patients often appreciate this. And the reason for that, I believe, especially having been a cosmetic surgery patient myself, is because with the beauty industry, there's just so much of this constant selling and pitching and misleading and, you know, trying to get you to buy the latest thing and the latest trend, that there is a level of mistrust that automatically exists between any beauty practitioner. And for me to sit there and tell you, hey, I could make X amount of money off of doing this procedure on you, but I'm not going to because I don't think you actually need it. To me, that speaks to a certain level of pride that that practitioner takes in their work, and it's a one way in which you might be able to parse out those who are just looking for a quick profit versus those who actually see you as an artistic canvas that they want to be proud of, and they want to be proud of their work ultimately. So that's what I would say when it comes to seeking out your own procedures, seeking out what you want to make you feel and look more beautiful. And these kind of people are the ones who are going to prevent you from falling into that trap of getting addicted. And at the end of the day, there is a lot of self-awareness that comes into play. You have to understand that no matter what, if you're somebody who's seeking cosmetic enhancement of their face, you're always going to have some level of a problem with an aspect of your face or your body. Nothing is ever going to be perfect, and that's why every plastic surgeon, frankly, and every beauty practitioner should be reinforcing the idea that perfection is not a possible outcome. By telling somebody that perfection is possible, that's when you can quickly have somebody cross that fine line of enhancement into addiction. Because what happens is they're going to be chasing the high of perfection, much like any other drug, and they're never going to get it. Nothing is going to be as good as that perfect image of you that filter created, because that's just not how our bodies are. That's the reality of it, whether you like it or not, frankly. In conclusion, I would say that plastic surgery it's not just about alteration, it's not just about enhancement, but it's really about helping you feel and look the way you genuinely want to and think suits you best. Right? It's a personal journey. It's a personal decision. It's not something anyone else should be telling you what to do. Granted, you can take people's advice, but don't let that be the only reason you seek out a cosmetic procedure, okay? And I think one of the key takeaways ultimately is going to be that cosmetic surgery is a tool. It's not a one-size-fits-all thing. You look at these celebrities, the pop stars like the J-Los and the Dua Lipas and the actresses like Meryl Streep and all these big name actresses who are known for the way that they look and are still beautiful at every age that they're at. And what they do is they don't just go to their surgeon every 5 minutes and say, "Make me perfect." No, these people have entire teams dedicated to their aesthetic. They have sometimes millions of dollars a year being funneled into their look. So the reality is, at the end of the day, you who's sitting at home and are working a desk job, not on camera, not being paid to look good, you may not have access to the same level of resources as a trainer, a dietitian, a cosmetic surgeon, a dermatologist, a whole team of people dedicated to making you look camera ready 24/7. So that's why I think you really have to sit down and think to yourself, what is it that you want? What fits your lifestyle best? If you're an influencer, your goals are going to be one thing. If you're a desk job worker, your goals are going to be another. And depending on what age you're at, there's going to be certain things that are appropriate for you and others that may not be so appropriate for you. So that's why it's really important that you take true ownership over your beauty journey, if that makes sense. So if you're thinking about having cosmetic surgery, biggest thing I would say, before you even schedule your consultation, check in with yourself. Make sure that's what you want. Talk to those who are closest to you about it, see what they think, and ultimately let the real decision maker be yourself, right? And go to a practitioner who's going to honor you, is going to respect you, and is going to be on your side when it comes to how they're going to treat you as a patient. So now that we're at the end of this episode, I'm going to do something at the end of each one of our episodes where I wrap up with a segment of beauty news that might be interesting, it might be gross, or it might just be plain fascinating. And this segment is called the Glam Gasp. So this week on Glam Gasp, we're going to be diving into the grossest urban phenomenon that's literally clogging up our cities, but have recently been linked in the beauty industry in an interesting way, to say the least. And this is our segment about fatbergs. What is a fatberg? Well, it's pretty much as disgusting as you would think it is, but it's something that happens not just, well, actually, initially it happens in things like sewer systems and in piping, where what happens is a lot of the fats that exist in, frankly, the excretions that a lot of people put into the sewer system, the fats will rise up and float on top of the sewage. What then happens over time is this fat begins to glob together and quite literally form a fatberg, which is a mass of fat that exists and just blocks up the pipes. What's interesting is in Australia, they have actually found and the thought is because of both dumping food and human waste and different things into the ocean, these fatbergs have actually started forming in the sea and have posed quite a problem, because the issue is, as you can imagine, these things don't look or smell very good at all. So one thought that has been thrown around, and an idea that I actually find it pretty fascinating, is that these masses may be used to create other things, and those other things are potentially cosmetic products. Scientists at the University of Edinburgh are looking for ways to possibly take these fatbergs, remove them from the sea, break them down, and repurpose the fats by obviously cleaning them off and sterilizing them, but then using them to form different cosmetics such as makeup products, lip balms, etc. I know that sounds so disgusting, but before you judge, I really recommend that you go look and see what exactly it is that a lot of these beauty products you're using are made up of and where these compounds come from. Because I think the more you look into it, the more you'll realize there's a lot of disgusting stuff that we repurpose and turn into our own beauty products and actually end up putting on our face, putting on our lips, and on our skin without having the slightest idea, because the compounds are so broken down. Typically they're in these scientific names that we have never heard of, like God knows what compound, N-methyl, blah, 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 whatever. So just be mindful that as gross as this sounds, I actually think it's an interesting way of trying to repurpose these waste balls, essentially, and trying to recycle things without having to create more waste by making beauty products. Question is, what do you think? Is it glam or is it gasp? Because I'd probably say it's a little bit of both. So this concludes our first episode of Uncensored Beauty. If you enjoyed what I had to say, please go ahead and smash the subscribe button below and make sure that you don't miss a single episode, and I will see you next time for another topic.